government. Today, a subject expert committee met to discuss emergency approvals for Bharat Biotech Serum Institute's vaccines that have applied for such approvals. However, the approvals have been kept on hold pending more data being given. The Pfizer vaccine's approval was not discussed. All of this leaves open the question, how will the government meet its proposed target of ensuring that 30 crore Indians are vaccinated by July-August? We'll be joined by the man in charge in a moment from now. But first, take a look at Milan Sharma's report on just what is the Modi government or the Indian government's vaccine plan.
India is counting its vaccine options. A subject expert committee on Wednesday studied applications filed by Serum Institute of India and Bharat Biotech for emergency vaccine use. The panel has decided to seek more data from Bharat Biotech and Serum. Meanwhile, a report published by Lancet says Oxford vaccine has 70.4% efficacy. But scientists point out that only 12% of the participants were above the age of 55. The good news, only 3 of the 24,000 volunteers reacted adversely to the vaccine.
I think the important thing today is that we put all of our data into a publication in the Lancet, which has been peer-reviewed and been through that scientific scrutiny. And I think that is, for us, is a really important part of this process to go through that independent scrutiny of the data and to publish, so that it's not only available for the scientific community to see exactly how the trials were constructed and what happened, but also that it's there for the public to be able to see it.
India, which is looking closely at the indigenously developed Bharat Biotech and Oxford vaccine, is ready now with a rollout plan. 1 crore healthcare workers will get the vaccine first. Then comes around 2 crore frontline workers. In the third phase, 27 crore people above the age of 50 and those with comorbidities will get the shot. The entire exercise will be technology-driven. The list of vaccine receivers will be made by states and union territories and uploaded on a digital platform called Co-Win. The same app will be used for registration and follow-up of vaccine recipients.
Even before the vaccine candidate for India comes forward, the government has put in place an ambitious rollout plan, because vaccinating 30 crore Indians is not going to be an easy feat. But the government is all set with the ambitious rollout vaccination that will be able to break the chain of transmission and hopefully end the pandemic in the country. With Ashwini Helen, this is Milan Sharma for India Today.
Let's raise some big questions then on that story. Should India be much more cautious before pushing ahead with its vaccine plan and picking vaccines? Is there a threat of safety norms that could get compromised? Is India's vaccine plan fully in place? Joining us now is the man really who is empowered to take all those big decisions. Dr. Vinod Paul is member health at Niti Aayog, but importantly also head of the expert group on the vaccination program. I'm joined by one of the country's top virologists, Dr. Shahid Jamil joins me, and Dr. Narendra Gupta, public health expert, is among those who has questioned the entire vaccine policy of the government. But to you, Dr. Paul, because you have committed, it appears, that by July, August of 2021, you expect 30 crore Indians to be vaccinated with the corona vaccine. Are you putting the cart before the horse when approvals still haven't come in place? Can we make those kind of projections and those timelines? On what basis are you saying that you hope that 30 crore Indians will be vaccinated by August 2021, sir?
Rajdeep, in the context of pandemic, when a powerful tool that can protect lives and even contain and extinguish the pandemic appears on the scene in the form of vaccination, we need to be prepared in advance. We need to have our thinking right, our tools right, our system right, and a clear vision, even though we know that this disease is novel, the vaccines are appearing in a certain sequence, some of them are unfamiliar because of their new platforms and so on. But to be prepared for, for this potential tool and intervention is the duty of the government. And that's what exactly we have done. What we have conveyed yesterday in our press conference is clearly our approach to immunize priority groups when the stockpile of vaccine available is somewhat less than the entire population that may potentially be considered as a candidate for vaccination. How do you go about doing it? Now, that needs clarity, and that clarity has been provided. In this, we have stated that certain groups, as you enunciated just now in your report, will be in the first wave of vaccination. It doesn't have to be an exact sequence the way you put it, but that's our vision. So we are starting with an aspirational vision that we have these high-risk groups. We would like to cover them as a first wave. Now, the point is how soon we want to achieve. Well, that is based on our overall thinking about how potentially affordable vaccines would be available to the nation. And when we put the two together, that we can say in the optimistic scenario, it is possible for us to translate that vision into action on the ground. This is the way it is moving, but we are also mindful of the fact that it is a dynamic situation, and we have to be careful as we move along and we modify our approach and adapt as required.
What you're saying is effectively suggesting that you have a vision plan in place. The question is the reality on the ground. As today's subject expert committee seemed to suggest, we still don't have final data of the Serum Institute phase 3 clinical trials. We still don't have Bharat Biotech with its phase 3 trials, yet both of them have applied for emergency approvals. Pfizer, there are question marks. So, the fact is, are we fast forwarding a process and as I said earlier, jumping ahead of where we should be? Should we be taking this a little bit more cautiously, waiting for the entire approvals to come in place? Or do you believe both processes take place simultaneously, the approvals and your plan for the vaccinations?
So 3 points in this regard, Rajdeep. First and foremost, there shall not be any compromise on the science and regulatory processes. There shall not be. And we have factored that in, that there will be candidate vaccines. They'll go a certain route. There may be requirements of completion of data and so on. This is, in a way, factored in our overall approach. And we know that those pathways and milestones have to be met. So first and foremost, there will be no compromise of science and evidence. And we are connected to the world and the science in this regard because we have a reputation to keep. The second part is that as the vaccine evaluations are done, the process that you are referring to today is part and parcel of that approach. More data should be made available. The data would be looked at. The paradigm for emergency authorization is in a way reasonably well understood as to the point where such a decision could be made. Those lines have been drawn. And therefore, you should see this as an evolving process. But I once again say that these scenarios have been kept in mind. But it is our duty that we are prepared on time for the vaccine rollout as soon as it is available for the people of India. If we would not do it, you only will then tell us we were not ready. So both the things are happening together. There is no question of jumping the steps or avoiding certain norms and regulations and critical elements in this whole story.
From what I get from you also is a vaccine. What I wanted from you was a clarity on the vaccine priority list. Healthcare workers, government and private, 1 crore. Frontline workers, this is personnel from state and central police departments, armed forces, home guards, disaster management volunteers, 2 crores. Prioritize age groups, 27 crores above the age of 50 and less than 50 years with comorbidities. Is that in some kind of sequence? Am I to understand that this will be sequential, or will you target this group as a whole over the next 6 months?
So the first principle is that we have looked at how much population is truly at risk that we would like to address in an aspirational way, not in a very restrictive way. If the vaccine is scarce, less doses are available, we can always come back to a narrower circle, but we want to be prepared for something which we think is visionary, which we think is in some ways possible, maybe with a little difficulty, which we think we would be able to match in terms of supplies with the domestic supplies coming up. So we have kept it more liberal, more optimistic. Now, the principle behind this approach are very simple. The largest proportion of people are 26 crore people who are above the age of 50 years, because 80% of mortality in COVID-19 disease occurs in those who are above 50 years. So if we immunize everybody above 50, technically you're taken care of 80% of mortality, and that is the key parameter that affects our nation and affects livelihoods, affects people and communities and families. So that is the underlying principle. The second principle is are people below 50 years of age who have significant serious morbidity, such as, let's say, kidney failure or cancer, or a woman with intractable condition, let's say. So these principles are generally accepted principles, and they are based on epidemiology and science. And to protect the healthcare workers and frontline workers is our duty to protect our healthcare system and the pandemic control system as we should, because this is the frontier where our fight and the battle and the war against the virus is going on. So we need to be sure that people who are fighting are protected, and this wall is never a weak wall. So this is the basis of the approach we have taken, and we hope that the required number of doses for these people will be made available at the earliest possible. And once this wave is done, we move on. We are saying this need not happen in a sequence. We begin somewhere, and as the stockpile becomes increasingly available, this will start to move in wave after wave, and eventually all moving together. But the group has been defined as a core group for the time being in the first phase.
Let me raise more concerns. Number one, pricing. The Pfizer vaccine, for example, abroad is already costing $20, which would be which would be considerably considered expensive in a country like India. Number two, serum's vaccine, we are told, will be given to the government at rupees 220. We don't know what price it will be given to average citizens. I want clarity again. Are issues like pricing already factored in, or are you still waiting to look at how Covaxin, Covishield are when they're available before making pricing details available to the country?
For the number of doses, for the stockpile size that we need for our country, we will in principle depend on domestic production. You must also remember that the vaccines developed outside India have a very little plausibility of additional doses being available to a country like ours, including Pfizer. Our understanding as of today is that they have very little to offer to India for some period of time, maybe a few months. So large part of our endeavor is based on the hope and the confidence that we will have indigenous supplies being made available. And we also believe that that will be considerably affordable. Yes, indeed, the potential prices have been factored in the action plan that we are bringing forth to the country as a way forward in partnership with the state governments and the state of India.
No, so are you telling me, Dr. Paul, sorry to intervene, are you telling me that till the Serum Institute and the Bharat Biotech vaccine are cleared, that's only when you can actually conceive of these millions of doses that you will need? 30 crore people will need 60 crore doses, assuming it's a 2-dose vaccine. I just want clarity on that is when you can actually scale up. The Pfizer vaccine requires a cold chain requirement of minus 70 degrees, unsuited for India. So the real hope that you are pinning all this on is for Pfizer and Bharat Biotech and possibly Sputnik V to be freely available. Am I correct?
Real hope that we are pinning on are the vaccines that are being developed in our country. It's about Serum vaccine, Bharat Biotech vaccine. It's also about Sputnik vaccine, which will be manufactured in India. It's undergoing phase 3 trial on the soil of India. Also the Cadila-Zydus vaccine and a couple of other vaccines which are in the pipeline. We have a very significant pipeline across a vaccine candidate that's available. At least 8 of them are in the zone where a lineup could be made, could be available in the next 6 months. And therefore, it is a bouquet of possibilities that we are looking at. Surely, if you are saying, are we dependent on vaccines that have been developed outside? The point is, we would like to. Issue is that the stockpile of those vaccines and the manufacturers have already committed those stockpiles for other nations. But they are available in significant amounts. We will be happy to consider them as part of our repertoire.
Okay. In a sense, you've given us what lies ahead. I appreciate, Dr. Paul, you sharing your time. I want to widen this now to Dr. Shahid Jamil and Dr. Gupta, who are also with us. Dr. Jamil, you've just heard from Dr. Paul saying that India is hoping for a bouquet of vaccines. Now, all of this is coming on a day when, in the case of Pfizer, for example, concerns in the United States that at least a few people have developed temporary facial paralysis. In the UK, 2 health workers have developed allergy. UK now saying those with allergies cannot take the Pfizer vaccine. Again, are we moving a little too quickly on this entire vaccination process? Do we need to press the pause button, Dr. Jamil?
No, I don't think so. I think I must congratulate Dr. Paul and the team that he heads, that they have a good plan that has been developed to roll out the vaccines. It's a sensible plan, it's a phased plan, and it is being developed in parallel with vaccines that are coming up for approval. Remember, it's the prerogative of the regulator to give approval or not. You can't fault the company for going and asking for approval. And I feel the regulator has done the right thing to ask for more data. So the way this is happening in parallel, we have clarity on who will get the vaccine first, how it will be rolled out, and all of that. So I don't think we're moving fast at all. And person in a responsible position like Dr. Paul has said very clearly on your show that there will be no compromise on science and safety. So let us just believe that, and today's events do tell us that the Indian regulator is looking at it very seriously and will not do anything that will erode trust in vaccines. So I think it's going perfectly fine.
I'm also joined at, okay, so you believe that the government's plan is moving in the right direction. Dr. Ashish Jha, Dean at the Brown University School of Public Health, is also joining us at this moment. But first you, Dr. Narendra Gupta, because you are among those who's written as a public health policy expert to the government of India as part of signatories, saying that this vaccination program is not a great idea. Why?
Yeah, so first let me say that we Indians should have a sigh of relief, essentially because many big events have passed through in last 2 months, especially Diwali had gone by, Bihar election has gone by, several other marriages have taken place in which large number of people have gathered. And I was just trying to find out that how many of these people who have gathered together in Bihar elections or in during Diwali in big cities and big places, how many of them got infected and how many of them have lost lives. I don't hear anything from anywhere that any such thing has happened. So that is one big relief. In fact, about 20 days back, when soon after Diwali, one of the very well-known pulmonologists of the country was saying that 20 days are very, very critical for India and you'll see a huge surge. Incidentally, instead of seeing any surge, what we are continuously seeing is a decline in the number of people getting infected. Though on the number of infections, I really don't care much because there could be huge margin of error in terms of the number of people getting infected. But death is a very definitive thing in which underreporting, over-reporting, wrong reporting.
No, so are you saying that we have moved? So are you saying So are you saying that we've reached a stage of herd immunity where the vaccination may not be necessary?
No, it could be necessary. But first of all, we have to establish a reason for it. That what kind of a vaccination we need for this country. Do we need a universal vaccination in which everybody need to be vaccinated and like create such kind of a environment around us that everybody begins to feel compelled to have a vaccination. Those who don't get vaccination, there could be vaccination riots the way it has been, blown up out of proportion. That is one thing. The other thing which I also want to stress on is about that you could see a very clear rich and poor divide, rural and urban divide as far as this particular disease is concerned. I have been taking down the notes that according to the latest SRS bulletin, the crude death rate of India is 6.2 per 1,000 per year. According to it, around 23,500 people die every day in this country. Out of that, only 521 people since the time 12th of March 2020 till today, till yesterday in fact, number of people who have died per day death had been 521, that is 2.02%. If you put them into the ranks of deaths which are taking place by different kind of diseases, then it ranks at the 11th position. There are other 10 diseases which takes higher.
So I understand what you're saying. You seem to be suggesting that at a moment like this, perhaps we need to press the pause button, you believe, before a universal vaccination is there for COVID. I take your point. This needs to be discussed. Professor Jha, you're joining us from... I take your point, sir.
There has to be...
Let me also bring in Professor Jha. Just a minute, sir. Professor Jha, let me bring in Professor Jha. Professor Jha, you as India prepares this vaccine plan, it comes at a time when there are concerns both in UK and US which have just been expressed in the last 24 hours over the speed with which these approvals have been given, concerns over possible facial allergies that are following taking of the vaccine. Should we be concerned in India at all?
Yeah, so thank you for having me on. So a couple of things. I mean, first of all, both the Pfizer and Moderna vaccines, I don't have much concerns about the way that they have been developed or the way that they have been approved. That there's been very careful. I mean, Moderna has not been approved yet, but Pfizer is gotten approved in the UK, will probably be approved in the United States in the next 24 hours. And it's, the science here is very, very good. The bigger concern to me is the AstraZeneca vaccine. That is what the Serum Institute in India has been building up, ramping up. That vaccine, I also don't have a lot. I think it's going to end up being a safe and effective vaccine, but the data has been far less clear, and the company has not been as forthcoming with sharing of information. So for me, vaccinations are going to be absolutely essential. I am not concerned about the science behind Moderna and Pfizer. I hope the AstraZeneca vaccine ends up being one of the ones we use, but we have to wait for more data on that before I would feel comfortable getting it myself. And of course, there are other vaccines in the works. So I think we need a little patience on some of those other vaccines.
But the reason I'm asking you this, Dr. Jha, is because in the Indian context, for example, Pfizer, many believe, is unfeasible, not just for cost, but because of the cold chain requirement, minus 70 degrees. So a lot of hopes are being pinned on the Oxford AstraZeneca Serum Institute vaccine. Do you believe that from an Indian perspective, we need to therefore wait to see more results, more trial results of the Oxford AstraZeneca vaccine before we can be confident of actually mass producing it?
So two things. First of all, on the issue of the Pfizer vaccine, beyond the cost, I know the minus 70 degrees Celsius is a challenge. I remind people that the Ebola vaccine also required minus 70 degrees, and they were able to get that out in the DRC. If they can get it out in the DRC, I think India can handle the Pfizer vaccine. Now, let's talk about the much more important one, the AstraZeneca one, because that's
DRC, Democratic Republic of Congo, yes.
Yes, Democratic Republic. They could do it there. We can do it in India. Now, on the issue of the AstraZeneca Oxford vaccine, the data came out yesterday in the Lancet. I've reviewed it. I think it will end up being a very good choice and a very good option for India, but I want to see more data than what they have released so far. And so I think the jury is still out on that. But I'm not saying we have to wait many, many months. I think we'll be getting more data from more trials that are ongoing. So far, it looks to be about 60, 70% effective But there is some more data that suggests that it may be more effective than that. I think we need to see those trials get done before we get into widespread vaccination.
Dr. Jamil, to respond to what Dr. Gupta seemed to suggest, that while we are talking about individual vaccines, he and some other public policy experts are saying, let's not jump into a universal vaccination program, making it mandatory. Are we sort of overestimating the nature of the pandemic and pushing ahead with the vaccination program too early? And, they seem to suggest big pharma in a way is driving this. How do you respond?
Well, the government hasn't said that they are going to vaccinate everyone or to make it mandatory for everyone. Right now, the plan is to vaccinate, 30 crore people, and based on a graded, in a graded manner, 1 crore healthcare workers, 2 crore frontline workers, and so on and so forth. Something that Dr. Paul, I think, explained very clearly. So where is the question of making it mandatory for everyone, or where is the question of vaccinating everyone? I don't think anybody is suggesting, vaccinating 1.38 billion people in India. That's not needed at all.
What about the fear of after effects, Dr. Jamil? The fear that is being expressed already in 48 hours in the West, in Britain today, about facial allergy. Those with allergies should not be taking the vaccine. Should all this be first sorted out before we look at exactly how far we are going to go with the vaccination program?
Well, so how long are you going to wait to sort it out? Remember, even hugely successful vaccines such as the oral polio vaccine causes 1 case of vaccine-induced poliomyelitis in 1 million people who get vaccinated. At one end, you want vaccines developed very quickly to control a pandemic. On the other hand, you're saying now that the vaccines are there, let's wait another 6 months before we deploy them. I don't think that makes any sense.
Dr. Gupta, you want to quickly respond to that? A quick response from you on that? That if we have the vaccines, if the emergency approvals are in place, if the trials go ahead within the next month, we must use them.
Absolutely. There's no denial to the fact that vaccines, once are available, its safety and efficacy both are established to a full extent. They should be used. No second opinion on this. The important point is that the way these vaccines have been pushed through, and I've been looking at the BBIL data, Bharat Biotech India Limited data, and I found that the number of people who have been on trial are just less than 200. If you get to see their data, and that is the reason they did not get more data has been demanded from them. That is one thing. Second thing is that we have no idea. See, this both Moderna vaccine and Pfizer vaccine have been used on mRNA platform. mRNA is for the first time being used for any vaccine for human illness. It's not been used earlier. There have been attempts and it did not succeed. So we really have no clue about the long-term effect of these vaccines, but that is one thing. For other reasons also, as I am a public health expert who works at field level, I see it as a logistical nightmare. See, the yesterday or day before yesterday, our Honorable Health Secretary was saying that we'll be using around 74% of our primary healthcare workers, that is the ANM who is stationed at the sub-center, to train them as vaccinators for this disease, for this vaccine, sorry. And the way they want to do it, it means that everything else will be all sidetracked, derailed. Only thing which will be just done will be this. And that may cause...
No, that's an important caveat that you put in there. Doctor, you're putting in important caveats. I just want to get in Professor Jha as a final word. Professor Jha, from your vantage point at Harvard, do you believe these concerns on the ground realities, training primary health workers in the vaccination process, are these real concerns that will have to be addressed before a country like India, used to mass immunization, actually goes ahead with the COVID vaccine program?
Yeah, so first of all, let me say very clearly, I am not worried about the mRNA vaccines. mRNA is something our body makes all the time. These vaccines have gotten studied among tens of thousands of people. The AstraZeneca vaccine has been studied in over 40,000 people. We're not rushing the process. So I think first we have to stop creating fear that somehow these vaccines are dangerous. They are not. They're being very well tested. On the issue of will we have to train healthcare workforce, of course. India has a long history of being able to mobilize vaccinations and does it as well as anybody in the world. But yes, there will have to be work on making sure we have healthcare workers trained in how to do this. Primary care providers will have to be engaged. But this is a global pandemic. India can't be the one country that chooses not to widely vaccinate its people. India must do this for the benefit of the health and well-being of its own people. So I am very supportive of the vaccination effort. I think we just have to follow the science and data. And the data's coming in, and the data so far really does look like these vaccines are safe and effective.
That's a good word to end on. Follow the science, follow the data. That's perhaps the best way forward. We focused on this issue and we will continue to focus on these issues because this is really the public health concern of 2020 and beyond. Thank you all very much for joining me here on the news today.